Hello and welcome. Today, we're diving into LEOPARD syndrome, a rare genetic disorder with significant implications for heart health, among other areas. Join us as we explore the complexities of this condition, from its causes to its management. LEOPARD syndrome is primarily caused by mutations in genes involved in the RAS-MEK signaling pathway. The most common culprit is a mutation in the PTPN11 gene, found in about 85% of cases. Other genes such as RAF1 and BRAF can also be responsible, although less frequently. These genes are crucial for cell growth, differentiation, and survival. Mutations disrupt these processes, leading to the diverse features of LEOPARD syndrome. The mutated genes in LEOPARD disrupt the RAS-MEK signaling pathway. This pathway is a critical cascade of protein interactions that regulate vital cellular functions. When one of the components, like PTPN11, RAF1, or RAF's mutated, the pathway becomes dysregulated. This dysregulation affects various tissues and organs, resulting in the characteristic features of the syndrome. Regarding the heart, the dysregulation affects the growth and development of the heart muscle, an electrical conduction system leading to conditions such as hypertrophic cardiomyopathy, pulmonary stenosis, and arrhythmias. LEOPARD syndrome is a rare disorder, estimated to affect fewer than 1 in 1 million people worldwide. It occurs in both males and females equally. Due to its rarity and the variability of its presentation, it may be underdiagnosed. Cases are reported across diverse ethnicities and geographic locations. The acronym LEOPARD summarizes the key features of the syndrome. L stands for lentigens, which are multiple small, dark brown spots resembling freckles. E represents ECG abnormalities, often related to heart issues. O signifies ocular hypertelorism, meaning widely spaced eyes. P denotes pulmonary stenosis, a narrowing of the pulmonary valve, a common heart defect. A stands for abnormalities of genitalia, which can vary. R represents retarded growth, though this isn't always present. And D is for deafness, typically sensorineural hearing loss. Importantly, not every individual with LEOPARD syndrome will exhibit all of these characteristics. The severity and presentation can vary considerably. Diagnosis of LEOPARD syndrome is often based on clinical findings, specifically the presence of multiple features from the LEOPARD acronym. Genetic testing identify mutations in the PTPN11, RAF1, or BRAF genes can confirm the diagnosis. Other diagnostic tests, such as electrocardiograms, ECGs, and echocardiograms, are used to assess cardiac involvement. Audiological assessments are performed to evaluate hearing, and ophthalmological examinations are done to check for ocular abnormalities. LEOPARD syndrome doesn't have distinct subtypes, but the severity and specific features can vary significantly between individuals, even within the same family. This variability is likely to the specific mutation involved and other genetic and environmental factors. Treatment for LEOPARD syndrome is primarily focused on managing the individual symptoms and complications. Cardiac issues, such as pulmonary stenosis and hypertrophic cardiomyopathy, may require medication, surgery, or other interventions. Hearing loss is often managed with hearing aids or cochlear implants. Growth hormone therapy may be considered for growth retardation. Regular monitoring by specialists, including cardiologists, audiologists, and endocrinologists, is crucial for managing the long-term health of individuals with LEOPARD syndrome. As LEOPARD syndrome is a genetic disorder, there are currently no known ways to prevent it. Genetic counseling is recommended for families with a history of LEOPARD syndrome to discuss the risks of recurrence and available reproductive options. Prenatal testing may be an option for at-risk pregnancies. The prognosis for individuals with LEOPARD syndrome varies depending on the severity of the condition and the presence of complications. Cardiac involvement is a major determinant of long-term outcome. Early diagnosis and comprehensive management can improve the quality of life and lifespan. Recent research is focused on understanding the underlying mechanisms of the RAS-MEK pathway and developing targeted therapies to address the root cause of the syndrome. Scientists are also exploring gene therapy approaches as potential future treatments. Ongoing research continues to shed light on this complex disorder, offering hope for improved management and outcomes.